Behind me is the Ministry of Health for India, the whole of India. I've just finished a meeting with Dr. Ramados, the State Minister of Health. The magnitude of the problem in India is enormous. 1.2 billion people, an enormous land mass, broken down systems. It must just be unbelievable. But the simple fact is, out of all the injections given, 62% are unsafe. So with 300,000 people dying as a result every year, something has to be done about it. Delivering a message to hundreds of millions of people was our mission.
The mission: inform, educate and help India.
So how many people is this clinic treating, do you think? Just 5,000 people this place is treating?
Single hospital, single doctor in the around.
Hello, are you doctor? My name is James, I'm from SafePoint. There are three, maybe 1, 2, 3 syringes on his desk, okay, that have not been thrown away. They're outside of blister pack. Now, I just want him to be honest with me and tell me that they are being reused and being honest with me so that I can give him help.
It is an incredible problem, and this problem is born out of many different reasons.
Top Cat!
Only on
Meow!
And welcome back to Top Cat with Mark Koska with SafePoint.
The fact is that a syringe costs about 2.5 rupees, and a cup of chai on the street, which most people enjoy, is 5 rupees. So 2 syringes is a cup of tea. Most of the time these drugs are 10, 20 times more expensive than just the syringe.
That's right.
So, it's completely out of balance, the whole thing. There's also kind of an agreed upon fatalism, which I've observed in India, where they will rely totally on the healthcare worker.
All right, we are going to take a last call about the syringes issue and other wider health issues. We got Reena here online. And Reena, what do you have to say? Meow.
Hello?
Yeah, go ahead. What's going on?
Actually, I work in a hospital. It's a civil hospital.
Mm-hmm.
And I recently joined there. And what I saw there that a single syringe is being used for so many patients.
So it's a government hospital or a private one?
Yeah, it's a government hospital.
Are you a nurse? Are you a doctor?
Yeah,
are you
I'm a nurse.
You're a
I'm
nurse.
a nurse.
Okay. And is it sterilized at least? I mean, not that it's any better, but
it's a disposable.
Same needle or same syringe?
Even same needle and same syringe. It's a government hospital, and the patients are very poor, so we can't, they can't afford buying syringes, so you have to use
Well, the government hospital is supposed to provide the syringes, not have them buy it, right?
Yes. They don't catch the point that one single syringe is being used for so many patients.
All right, Reena, thanks for your call. We appreciate your courage coming out here.
I'm a young Indian nurse working with public health system. I've seen a lot here, good as well as bad. I have witnessed so many things, one of which is reusing of syringes.
These nurses were filmed secretly in a government hospital for 30 minutes. The tray they are using has medicine on it for all the patients on the floor, yet they only have 2 syringes. During this time, not once was a new syringe taken from a packet. The nurses openly throw the syringes back in the tray, then pick them up again to give the next injection, and not one patient or bystander ever challenges them.
This is an emergency ward, so you can see the patients are coming straight in being treated. And you can see that they use syringes, use needles in this institute, this educational institute for medical practice. This is where they teach people how to be doctors, man. And they're performing unsafe injections. Let's go and have a look. Okay. So look at this, guys. This is these are syringes that are waiting to be reused. How much time has it taken to collect that amount?
That time like that.
Half an hour. Did you catch that? That's half an hour's. The syringes are being kind of collected, they're not being destroyed as they're used. So now what we've been told is that they wait until the pile gets big enough to then take it to an incinerator. The first thing though, after the injection, they should be destroying it. They should be actually taking the plunger out, snapping it up. They're not doing any of that. These syringes could be reused, and the question is, are they being destroyed? Sure. So the needle you're destroying in the needle destroyer.
Yeah.
But
First we burn the needles.
Yes, burn it.
And then we dispose it.
And then you dispose it.
Yeah.
It's much safer. Yeah. Good, very good. And then the plastic syringe, you are sterilizing.
No, we don't sterilize it. We dispose it.
But I see.
This is a mistake. But this is all the syringes we dispose.
What is this? It's on, but it's closed. No, closed. It's on. It's closed. It's closed. See there.
So you can see plastic syringes. Yeah.
See?
Can I see that?
All the syringes we dispose.
Very interesting. So these 3 syringes here is just a mistake.
Yeah.
Just a mistake. Right, thank you very much. Thank you. Jesus Christ, you can believe what we've got here, man. This is just jam-packed full of bare needles, this one. This is supposedly an incinerator, Sean. The incinerator is literally right behind you. And all this waste is just sitting here. Bare needles. And not just that, just around the corner when kids are playing and walking barefoot, there's needles sticking out of the ground.
There's kind of an agreed upon fatalism. These healthcare workers are of such high value, you don't argue with them.
Never happens that there is no incineration any day. It never happens.
You don't question what they're doing.
So when you go to the dispensary, do you have to buy your syringe or does the doctor supply?
The doctor supply itself.
Ah.
Yeah.
Do you remember seeing him open the packet?
No, we don't see much because we have faith in the doctor.
Yes.
Can you imagine when you go to the hospital, the syringe which is being used for you has been used before also, and that for a patient with an HIV, you might get that HIV with that.
It's a normal assumption for people to trust their doctor.
Yeah.
So if a doctor...
Because in India, actually, no, doctor is next to God.
Yes.
People
next
are
to God,
that,
really?
Yeah.
Wow.
Because the savior is first God and the next is doctor.
I have witnessed that syringes are being used even 30-40 times a day. I have seen that. And the government can do a lot about this. A lot.